Hello and welcome. I'm Professor Obaidus Sattar. As you prepare for our upcoming workshop, I want to introduce you to a document that is, perhaps, the most powerful upstream intervention you have for public health. It's not a new vaccine protocol or a hospital directive. It is the National Education Policy of 2010. Now I understand. You are health leaders. Your world is one of clinics, data, patients, and policy. You might be wondering, why is an education policy a critical tool for my work? The answer is simple, and it's the premise for all our work together. You cannot build a healthy nation without building an educated nation. The National Education Policy 2010 is far more than a set of rules for schools. It is a blueprint for a new Bangladesh. Its core philosophy is to create a pro-people, science-oriented, and non-communal society. Its goal is to shape citizens who are not only skilled and knowledgeable, but also ethical, patriotic, and guided by strong moral and social values. For you, as health leaders, this policy is your most vital partner. It impacts your goals in two fundamental ways. First, by creating a health-literate public, and second, by building your future workforce. Let's talk about that first point. Creating a health-literate public. Think about your biggest challenges: patient compliance, preventative care uptake, the spread of misinformation. The policy tackles these at their source. NEP 2010 mandates that health, nutrition, and hygiene are core parts of the curriculum, right from the primary level. Chapter 18 makes health and physical education an obligatory subject in primary and secondary schools. This isn't just about sports. The policy explicitly states that this education is designed to make students mindful of physical exercise, discipline, and healthy living. It's a direct strategy to combat the rise of non-communicable diseases and to give young people a positive outlet, steering them away from dangers like drug abuse. Furthermore, the policy's emphasis on science education, as outlined in Chapter 11, aims to create a science-minded public, a public that understands why vaccines work, a public that values sanitation, a public that is, in short, your greatest ally in preventative health. The policy also champions inclusive education for children with disabilities, mandating integrated systems and specially trained teachers. This is a public health imperative, fighting stigma and ensuring health access for our most vulnerable populations. Now, let's look at the second major connection: building your future workforce. The NEP 2010 directly shapes the quality and quantity of every colleague you will ever hire. This is your pipeline. The most direct link is Chapter 10, Medical, Nursing, and Health Education. This chapter is your workforce blueprint. Its stated goal is to build a healthy and efficient population by producing a multi-tiered, skilled, and accountable health workforce. The policy sets the standards you rely on. It's what mandates the 5-year MBBS, followed by a 1-year internship. But it goes deeper. It stresses the need to create doctors, nurses, and health workers who are not just technically skilled, but also sensitive, compassionate, and possess a sense of social responsibility. It calls for a massive expansion of quality nursing and paramedical education to strengthen the entire health system. But your workforce isn't just doctors and nurses. What about your lab technicians, your data analysts, your IT support staff? That's where Chapter 5, Vocational Education, and Chapters 11 and 12, Science and IT Education, come in. Chapter 5 is designed to create a skilled human resource with certified skills. These are your future paramedics, dental assistants, and medical equipment technicians. Chapters 11 and 12 ensure you have a pipeline of science graduates for research and, critically, an ICT-skilled workforce. In an age of digital health, telemedicine, and health informatics, these graduates are the new foundation of a modern health system. So, you see, the National Education Policy is not a separate document running on a parallel track. It is the very foundation upon which your public health goals are built. It creates the informed public you serve and the skilled professionals you serve with. Education is the investment. Health is the return. As you review the materials, I want you to think about this partnership. Think about how your health office can collaborate with your local education office. I look forward to exploring these ideas with you in our workshop. Thank you.